Greetings. I'm Dr. Justin Groovy at ChiroMend, our Natural Health Center, and this is our first of many video series that we're going to be launching. And I figured that we'd start this process by adding in some question and answers that we get from patients, that might help just to kind of get some information. And one of the most common questions that we get is, I have this pain, I don't know what to do. Should I use heat? Should I use cold? And we actually have a lot of patients who are not doing this correctly, and as a result actually prolong their pain and are in worse pain for longer. More or less physiologically, heat and cold both do the same thing. The idea is we're supposed to bring blood flow in to try to remove toxicity, inflammation in a stagnant area. So let's say we have a strained sprain, a local injury that might have happened on the field or fallen down the stairs, and we have these fibers that tear apart, right? Now when this happens, the inflammation comes in, the immune system calls in the cavalry, and that's important basically for the healing process to begin. However, a lot of times this inflammation or the cavalry of the immune system comes in, and it's like an overly congested, very hot, overly inflamed response. And this amount of inflammation needs to be controlled and managed and decreased in order for the body to heal more rapidly. So heat and cold physiologically, again, what they do is they bring blood flow in. Now, when you apply heat to something, what happens is all the vessels, all the area basically gets warm, and everything starts to relax, and the vessels open and they dilate, and blood flow is allowed in or out of an area. Now, this works great. However, if an area is already inflamed, it's already hot and swollen, and there's new inflammation present, we might not necessarily want to use heat in this case, because it's almost like putting gas on a fire. Whereas the inflammation may actually increase as a result of heat. It'll feel good while you're putting it on for like the 15-20 minutes, but then after things are done heating, the pain levels oftentimes are higher and will be sustained for a longer period of time. Whenever we have a new injury, a new inflammation, a new pain that wasn't there before, what we want to do is use ice. Now ice, what happens physiologically is the vessels initially will close because everything's cold, right? So we get that reaction of like tight, right? But as the cold progresses, the cold kind of goes, whenever we're icing something, we call it C-band. It should be cold, burning, aching, and then go numb. So once it's cold, it'll kind of ache a little bit, and then it starts slowly numbing out. And that's the cold actually. What it does is, initially all the vessels tighten, so you get this pump, right? But then as the vessels numb out and they start relaxing as a result of the cold, everything numbs, and the nerves calm down, and everything opens again. So we get that dilation, we get the vessels opening where the blood flow can go in and out. And the nice thing about the cold, again, is that because there's all this hot, swollen inflammation in the area, what it does is it also decreases that inflammation at the same time. And that can have a prolonged or a longer lasting effect, which also would decrease pain even after we are done using a 15-minute ice pack. So generally, again, if we're looking at hot or cold, it kind of depends on the situation. But if we're dealing with a new pain, something you didn't have before, something that may, again, may have a simple strained sprain, something that we pulled a muscle or a ligament, cold is generally going to be safer as long as we're not, icing, too far. Basically, 15-20 minutes is usually about right. Again, if you're not sure, or if we do have an injury that needs to be looked at, obviously go see a doc and figure it out. But that's generally how I go about it if we're trying to figure out whether we're going to use hot or cold.